Hi everybody, we're going to get started in a minute. Everybody's back and had their cup of tea and whatever. Who's Lulu? Right. I don't know if there's anyone here who's just joined us who wasn't at the earlier session, but I will repeat a few things just in case. So my name's Joan Twelves. I'm on the Zero COVID Steering Committee. I'm based in London, in Lambeth. And as I'm sure most of you know, the Zero COVID campaign is a grassroots activist campaign which aims to eliminate community transmission of the virus. The earlier session heard from a range of speakers across Europe and very much heard the difficulties people have in trying to get governments to actually do the kind of things we need to do to effectively eliminate the virus and, in fact, stop and block second, third, fourth waves, each one seemingly more virulent than the last, killing more people. So we have to be building a solidarity movement of activists who will keep on putting up the pressure. Because as the World Health Organization has said over and over and over again, none of us are safe until we are all safe, because it is a global pandemic. It's not restricted to one country, but you wouldn't think that from hearing when you listen to most of our governments, particularly in the UK, but elsewhere as well. And what we are now seeing is what I think it is actually a marvel of modern medicine, that we have so quickly developed vaccines against the virus, but we are now seeing vaccine nationalism and vaccine apartheid. And part of what our task has to be, as well as working towards getting proper other systems in place, because the virus is only part of it, and the vaccine is only part of it, but we do have to work with people to make sure that those vaccines are available to everybody across the world, because without that, we will not be able to kill off this pandemic, right? So we have speakers this afternoon from the global south. Having listened to Europe, we're now going around the world. And I think it's quite important that we listen to what is happening in other countries. Certainly, I've been horrified in watching what's happening in India on our TV screens, given that not very long ago, they had reduced the number of cases down to a very, very low level. And then it's come zooming back because everybody thought they were safe. They thought they'd got rid of it. And it moves very, very quickly. And as was explained at the earlier session, governments don't seem to understand exponential growth of the virus. So, a few housekeeping tasks. We are live streaming as well as on Zoom. We have closed captioning, which you can click onto from the bottom of your screen, but we're also live on Otter. So if you click the CC live transcript button at the top of the screen, that's actually a better transcript if people want to use that. These settings may appear under more or meeting settings depending on your system. If you find the subtitles distracting, you can also switch them off in the same place. They switch on. As I said, it tends to come under more depending on how wide you've made your screen at the bottom. Mine doesn't show it at all at the moment. Zoom chat has been closed other than for messages, but we have got a Google document for comments where you can chat there. So it's less distracting, and the link to that has been posted in the chat. So that you can do that. Everybody is muted. Either I or my co-hosts will unmute you when it's time to speak for the speakers. When the speakers have finished, then we will be taking questions and answers, and we will probably do it in blocks of 3 or 4 and get the panel to answer. And I will take it on the basis of hands up, unless you've put in the comment sheet you have a specific question that you would want to ask. The speakers will speak for 10 minutes and I will give them a warning, 2 minutes to go. So our first speaker is Fatima Hasan. Welcome, Fatima. Let me just unmute you so that should work.
Thanks, hi.
Hi. Right, let me just introduce you. Right, Fatima is a human rights lawyer and social justice activist and the founder of Health Justice Initiative. She's dedicated her professional life to defending and promoting human rights in South Africa, especially in the field of HIV/AIDS, where she works for the AIDS Law Project and also acted for the Treatment Action Campaign in many of its legal cases. So Fatima, over to you, please.
Thank you. So yeah, just really great to be here this afternoon with my fellow panelists. I'm just going to take you through the situation in South Africa at the moment, which, you know, and really my heart goes out to the activists and healthcare workers who are dealing with the situation in India and Brazil. So ours at the moment is not as dire as that, but we do believe that we could be entering a third wave quite soon, because we're seeing in a number of provinces in South Africa an increase in the positivity cases, and we've also seen a spike in the number of excess deaths. So unlike you or many of you in the global north, our vaccination program has not yet commenced. We still giving vaccines from a study stock through the Johnson & Johnson study trial for healthcare workers. Less than 300,000 healthcare workers in my country have been vaccinated. And so I think it just illustrates the numbers that have been coming out this week, that 1 in 4 people in the global north have been vaccinated. My friends in New York who are 35 and 40 years old are getting a vaccine. My mum, who's 75 in South Africa, is still waiting for a vaccine. So there's something quite absurd about the disparities. And that actually translates into 1 in 500 people in the global south that currently have received a vaccine. So obviously we're dealing with a global inequity crisis, and I think what Joan talked about earlier in terms of a vaccine apartheid. And really, I think, you know, we warned about this at the beginning of this pandemic when people were talking about solidarity and sort of issuing nice press statements and saying nice words, that if you don't deal with the pernicious form of profiteering of the pharmaceutical industry in this pandemic, we potentially could go down the same road that we did with HIV/AIDS, where lives don't matter, but profiteering does. And I think this past few weeks, we've just seen this replaying itself over and over again. So in addition to, you know, waiting for supplies, and basically the pillar of South Africa's vaccine program is going to be Johnson & Johnson and Pfizer, because we've stalled the rollout of the AstraZeneca vaccine, and that's a separate conversation we can have about the decision-making behind not using the AstraZeneca vaccine for South Africa. So basically I call it a hostage situation, where we kind of totally deferential to Johnson & Johnson and Pfizer for the supplies that are meant to be coming in over the next 12 months. It's estimated that me, for example, somebody who's under 65 or doesn't have a comorbidity, will only be able to get my vaccine appointment in February or March 2021. And this is one of the more wealthier, powerful countries in the continent of Africa. So I think it gives you a sense of perspective of what actually is happening in Africa. So in addition to trying to get vaccine supplies, wait for the vaccine supplies, determine what the appropriate vaccine selection is in a context where science is moving so fast, where data is not being shared fast enough, where new information is coming out on an almost weekly basis, we have basically agreed, by we, I mean the South African government, to non-disclosure agreements with Pfizer and Johnson & Johnson, to high levels of secrecy, which basically undermine all the democratic traditions of our country, including all of the constitutional protections, because we are desperate for vaccines. We want them and we need them, and they could be life-saving and potentially could take us out of this pandemic. In addition to that, we've basically succumbed to the demands this past 2 weeks, where they've insisted on a no-fault liability scheme, which basically precludes the ability of any person living in South Africa from suing a vaccine manufacturer, even for willful negligence or, you know, any types of liability. So all actions have to be directed at the South African government, which the public is funding. And this is a similar situation to what we saw happen in relation to Pfizer with Brazil in Latin America, and one of the panelists will speak to that as well. So we have a no-fault injury scheme. We have non-disclosure agreements. We have high levels of secrecy. We finally now know what the price is. We're getting a drip feed of supplies. And basically, we participated in 5 of these clinical trials, including Pfizer and Johnson & Johnson and AstraZeneca. So we, as South Africans, contributed to global scientific knowledge. People in the global north, in Israel, in the US, in the UK, and parts of Europe are benefiting from that knowledge, but we are not as yet, and we're still waiting. And I think the worst part of this, and this will be my final point, is that our country, knowing what we went through with the HIV/AIDS crisis, where hundreds of thousands of people prematurely suffered and died because we couldn't get access to affordable ARVs because of the way in which the pharmaceutical industry normally operates in an epidemic. We warned that if you rely on benevolence, if you only rely on COVAX, if you only rely on voluntary measures, if you only rely on charity, you're going to have an access inequity, not just in South Africa, but in the rest of the world. And that is a situation that has played out. And so our country with India in October already of 2020 asked for what's called the TRIPS waiver. And I'm sure Nick will speak about this in detail in his presentation. And that waiver has been blocked by a handful of nations. It's supported by over 100 countries. It's been blocked by a handful of nations, including the US and the EU, Australia, New Zealand, Switzerland, Japan, etc., who have started their own vaccination programs, but are precluding or preventing the ability of countries in the global south from ramping up manufacturing and scaling up production, not just of vaccines, of oxygen, of diagnostic testing kits, of ventilators, of any COVID-19 related technology for the duration of the pandemic. And I think that I think tells you the power of the industry and sort of the situation that we're in, which basically I refer to it as a hostage situation. This week we've learned that even though the industry is critiquing the TRIPS waiver request and saying that alone will not translate into access, they've hired over 100 lobbyists to basically do work in DC to stop the waiver. And so there is an army of lobbyists and PR companies that are now trying to counter some of the messaging that Global Justice, Oxfam, organizations like MSF and groups in South Africa have been pushing. Because in this case, we actually do support our government and that of the Indian, the proposal of the South African and Indian government to actually push for the TRIPS waiver. I can in the Q&A talk about COVAX, how we're still waiting for COVAX supplies. They haven't landed. It's overpromised, it's underdelivered. There are bilaterals that have been signed with the African Union Vaccine Acquisition Task Team, again with Pfizer, Johnson & Johnson and AstraZeneca, and we're still waiting for those supplies. So even though we potentially have 3 different mechanisms to be able to access supplies, in each of those cases, we'll get a drip feed. And in each of those cases, we're still waiting for the supplies because like I said earlier, the industry has set up a number of demands. Until the South African government meets them, they will not release the supplies. Thank you.
Whose office is just up the road to me, and who will be talking. He's the director of Global Justice Now, a campaign for a more just and equal world. And today, Global Justice is focusing on campaigning against Big Pharma and patents and for international health solidarity. Before joining Global Justice Now, Nick worked for War on Want and Amnesty International, and I'm just going to unmute you. There we go.
Thanks very much. Can you hear me?
Yes.
Great. Thanks, Joan. Thanks for inviting me. And it's a real pleasure to speak after Fatima, because one of the things that first got me into activism and internationalism in general was just how utterly unacceptable that situation she's described in Southern Africa in the late 90s and early 2000s was, where we actually had the medicines to prevent the spread of HIV, to extend the lives of people suffering with it, and to ease their suffering. Millions of people we're talking about, but those people couldn't access those medicines because they couldn't pay the prices that Big Pharma was charging for them. What better example of the value that our global economy assigns to people's lives around the world, especially the lives of those living in the global south? Look, the way we manufacture and produce medicines is entirely broken. It was broken before the coronavirus pandemic, and I think now everybody can see a lot more clearly how broken it is. Well, I say broken, if the purpose of the system is extracting as much money as possible from the public sector and for the rest of us in society and handing it to the super rich in terms of their shareholders and investors, it works very, very well. But if the purpose is building a healthy world where we can all enjoy the rights to a decent life, it's completely broken. And the reason, part of the reason anyway for that, is that big pharmaceutical companies like Pfizer in the mid-1990s wrote the rules of intellectual property, went to the WTO, got them passed, and foisted those rules onto the rest of the world. And what those rules say is that essentially a big pharmaceutical company, once it owns a patent on a medicine or a drug, no matter how essential that is for the health of the world, they can essentially charge whatever the market will bear for that. For at least 20 years, they get all sorts of secrecy around the research and the trials and all the kind of stuff that we need for collaborating on the medicines the world needs. That's all secret. And they have special rights to make tiny changes to those medicines and then be able to extend their patents even further into their future. And what that means is that they've really rendered the pharmaceutical sector completely inappropriate and unable to produce life-saving medicine. So actually what Big Pharma spends most of its money, resources and time doing is lobbying governments to extend their patent rights even further, litigating to prevent companies that are trying to produce their medicines cheaper, to try and stop them doing it, buying up companies who are actually doing some of the really important work of developing new medicines, and developing medicines that treat but don't cure chronic conditions that tend to be suffered by either fairly rich patients or patients in countries lucky enough like ours to have a national health service that can pay the prices that they're demanding. And it's so broken that this isn't just kind of radical campaign groups talking about the need for change. Jim O'Neill, who's a former bigwig from Goldman Sachs, who sat in the House of Lords on the Tory benches until recently, said this system is completely dysfunctional and they don't seem in any way able to change. And so he's recommending that parts of the pharmaceuticals system need to be nationalized, need to be taken into public ownership. So that's the kind of breadth of the people in society who are calling for change here. And indeed, it's not just coronavirus. When we look at things like antibiotics, which really underlie our entire health system and medical knowledge at the moment, they are becoming more and more resistant to drugs. And part of the reason is not just the overprescription, although that's important, and the use in animals, but also the fact that Big Pharma has had no interest in developing new antibiotics for 30 years now, which is why we haven't come across any more. So really massive problems right at the heart of the system. We saw these problems right at the beginning of COVID. It wasn't a surprise to anybody, sadly, that we've reached the situation we're in. And indeed, the World Health Organization and others tried to find ways of preventing the vaccine apartheid that Fatima's described from coming to pass. One of those ways was COVAX, the international distribution system, which was supposed to allow fair access to vaccines and treatments all around the world. Well, that was simply bypassed by rich countries who decided, well, that might be good enough for global South countries. It's not good enough for us. We're going to buy all the drugs on the market in advance, which left COVAX with very little to actually purchase. The second thing they did is set up something called CTAP, the Coronavirus Technology Access Pool, which was an attempt to pool the knowledge that we've got and the patents associated with that knowledge so that we could learn from each other, we could collaborate, and anybody who needed to would be able to access the science and the know-how to produce themselves. Sadly, it probably won't surprise you to hear all of the big pharmaceutical corporations, led particularly by Pfizer and their lobbying industry, have boycotted CTAP. So it has no knowledge to share around the world, which is just absolutely scandalous. And it's particularly scandalous when you bear in mind that the companies that are currently producing this vaccine, in many cases, did very little to invest to create the research behind it. So, from AstraZeneca to Moderna, by and large, that research and development was entirely done by the public sector and by charitable institutions. So The extent to which this is even really their drug, I would really question very heavily. And in fact, AstraZeneca, as you probably all know, was invented at Oxford University. The researchers behind it said they wanted it to be patent-free and available to everybody. The Gates Foundation stepped in, did this deal with AstraZeneca, and all of a sudden we've privatized the research that we've paid for. And that happens again and again and again. And then TNCs can kind of go away and charge whatever they like. So Pfizer had its AGM this week, is going to bring in on its vaccine about $30 billion this year. $30 billion. We looked at their annual accounts earlier in the week, and we found out that they'd returned $8.4 billion to shareholders last year at a time, driven largely on the back of these vaccine breakthroughs that I say have had phenomenal amounts of public investment. So again, the super rich in the world are doing extremely well out of this, while others are suffering from a lack of vaccines. And that's why, as Fatima said, South Africa and India went to the World Trade Organization back in October, November, and said, for goodness sake, suspend the patents and allow us to produce and ramp up manufacturing so we can give as many people as possible a fair chance of getting this vaccine as soon as possible. And wouldn't you just know it, every rich country in the world, with the exception of the Pope and the Vatican City, have blocked that proposal. So the countries that have bought all of these vaccines have turned around to the global south and said, no, don't worry about it. There's not really a problem. The market will solve your problems in the long term. So, and that's the situation we're still in now. However, that doesn't mean, despite the scandal and the awfulness of this situation, that doesn't mean I'm actually pessimistic about the next year or so. Yesterday, I was in a rally where there were just congressperson after congressperson, senator after senator in the US coming on an online rally and saying they were putting as much pressure as possible on Biden to consider waiving patents. Biden is probably amongst all rich countries one of the leaders of a country who is now seriously considering this for many, many reasons, and that doesn't often happen in terms of the campaigns that we're running. So this is quite an exciting moment where I think the sheer inequity and unacceptability of the pharmaceutical system is under massive challenge. And we're seeing every day now companies coming out saying, we want to produce this. This morning is a great piece in The Guardian, a comment piece by a journalist who's interviewed a company in Canada that said, we've been trying to produce this now for 6 months. Big Pharma won't give us the patents. We could have produced hundreds of millions of doses by now if we'd been allowed to. So even part of the business community is saying, we've got to be allowed to produce these vaccines. So I think we're getting there.
Another couple of minutes.
Absolutely. Thanks, Joan. I'm really very close to finishing. I think we can get there if we keep up the pressure. This is one of those big moments in terms of global campaigning that I remember from back in the 90s and early 2000s, where we can actually win something. And we've got to, because this system of monopoly capitalism, which is embedded in the big pharmaceutical system, isn't just a problem for our healthcare. It's a problem for the amount of control that big technology companies have over our lives and our privacy. It's a problem for the massive state action that we need if we're to be able to deal with climate action. We need to challenge it. We need to confront it. And if this awful virus gives us the opportunity to do that, let's make the best of it and challenge and confront this power and create a real people's vaccine. Thank you.
Thanks very much, Nick. And apologies for having failed to unmute myself when I was introducing you. Apologies to you and to everybody. I thought that was happening. I usually am really good at this. Anyway, thanks very much. Our next speaker is Marina Cayozeta, which I've probably pronounced totally wrong, and I'm sure she can correct me. She's a physics undergraduate and one of 5 city councillors who share a mandate in Florianópolis, Brazil. The 5 women decided to run for one council chair and share the works and benefits of this position between them. And together they are the Collectiva Ben Viver. They are affiliated to the Socialism and Freedom Party and fight for eco-socialism, a society without class divisions that lives in harmony with nature. Right. I should have managed to unmute you. No?
I think it worked. Can you hear me?
Yes.
Yeah?
But I don't know what the bleep is, if that's you or... yes, it's my phone.
All right. So thank you, Joan. My name is Marina Cayozeta, but it was a good effort from you. I appreciate it. So I am a city councilor in Florianopolis here in Brazil in a collective mandate, like she said. And together we are Coletiva Bem Viver, which would be loosely translated as Living Well Collective. But like Eduardo Gudinas, Uruguayan leading scholar on Bem Viver, I don't think that this translation fully transmits what this expression means. Like he said, it sits too close to Western notions of well-being and welfare, and these are not equivalents at all. And Bem Viver is also a translation from Quechua, language spoken in the Andes. And the expression is sumak kausai, that means living with completeness and fullness. So I would like to make one small request, if it's not too much from me, that you refer to it in Portuguese or Spanish, because I think that it transmits better the meaning of the expression. So I'm here today to talk to you a little bit about the pandemic situation here in Brazil. And I don't know how well you know about it or if you're following Brazilian news, but we're going through a very critical moment right now. According to the Washington Post, the New York Times, the Eurasia Group, which is a political risk research and consulting firm, and several newspapers and international organisms, Jair Bolsonaro, our president, is the worst or one of the worst leaders in dealing with the pandemic in the world. And I've prepared here a timeline with the main pandemic facts and some of his controversial and absurd quotes related to it. So in February 26, we had our first COVID case here in Brazil. And in March 10, he said that a lot about it is just fantasy. It's not as big as the mainstream media spreads. In March 11, the World Health Organization declares COVID a pandemic. And in March 17, we had the first death in Brazil. And in the same day, he said, the virus has brought some kind of hysteria. In my opinion, some governors are taking some actions that are going to affect our economy a lot when referring to lockdown. In March 24, he said, given my athletic history, COVID-19 doesn't really concern me. I wouldn't feel anything or have any symptoms, at most a little flu or a little cold. In April 4, he said, we together with religious leaders are announcing a request of a fasting day to Brazilian people so the country can get rid of this illness as soon as possible. Between April and May, 2 health ministers resigned for not following his orders on using chloroquine and this unproved health medicines. And in between these 2 resignations, he said that he is not a grave digger. And when asked about what he was going to do about it, he answered, so what? I'm sorry, but what do you want me to do? In August, after 100,000 deaths in the country, he said, the media discouraged chloroquine, but even without scientific evidence, it saved my life and the life of thousands. In November, he said, I mourn the deaths. We're going to die someday. We're all going to die someday. We can't escape that. We have to stop being a country of sissy boys. In December, he said that we were at the end of the pandemic. And in January, we started vaccinating people. And he continued saying that it was not scientifically accurate or telling journalists to go buy vaccines in their mother's house. Last year, he rejected Pfizer's offer of 70 million vaccine doses. Research conducted by USP, the University of São Paulo, concluded that the federal government performed a COVID-19 spread institutional strategy after analyzing laws, policies, decisions, speeches, and official measures. They say that Bolsonaro was not only neglective, but he actively helped the spread of the disease. I've heard people today saying that all countries in the world, lots of countries in the world lack testing, lack in information, lack in financial support. And that is all also true for us. But I kind of hope that it was only that. And the parliaments here in the country are the places that have been responsible for the decisions and measures that have been actively helping in containing the transmissions. There were initiatives like making the coronavirus discussions an economic priority, implementing financial support for people who lost their jobs or couldn't work, sanitizing measures, distribution of individual protective equipment, getting the vaccines, because he wasn't really worried about really getting the vaccines. And lockdown was only possible in the states where the governor is not a negationist, which is not my case, because we didn't have lockdown here. After all of this kind of disturbing his timeline of our recent history, I think it's important to reinforce the importance of our public health system, SUS, because having it well built is what is keeping us alive, so to say. It exists since 1988, and it has a very good vaccination structure. For example, during the N1H1 vaccination campaign in 2009, we were able to vaccinate 80 million people in 3 months. Now, we have already vaccinated about 12 million people with the 2 doses, and almost 29 people have received the first dose. And even though the numbers sound big, they represent only 13 and 23% of our population. And we have been producing the AstraZeneca vaccines here in the country. So the amount of vaccines that are actively getting to people is really, really small. 10 years ago, we were able to vaccinate 4 times this amount in less time, which would be now more than 50% of our population. And that's what we needed in order to avoid being the situation that we are right now. And the situation is, for the last month, we have an average of 60,000 new cases each day. I read this and it makes me want to cry. And 4,000 deaths.
Another
What?
2 minutes, Marina.
Okay. And 4,000 deaths every day, adding up to the 386,000 registered deaths in total. Sorry. On top of that, we have the new strain that appeared here, the P1 in the city of Manaus, that today corresponds to 91% of COVID cases in Brazil and is 2 times more transmissible. And it was also concluded that it's killing 2 times more people, but it's not possible to assess if this is related to the lethality of the virus or the collapse of the health system, the lack of oxygen in hospitals and such. I would like to talk a little bit about Bolsonaro's rising and approval, but since we don't have time, I will finish here. I appreciate very much the invitation, and that's it. Thank you. Your microphone is mute.
Yes. Thank you so much for that. That was excellent. I know everybody was really into that. And obviously you'll come back at the end so you can finish off other things you want to say. What I'm going to do is invite people to stick their hands up. You do that under either reactions on the bottom of your screen, or some systems have it so it's part of at the bottom of participants at the side. And I haven't got any hands up yet. So, right. Nick Gotts, I will unmute you.
Thank you. Thanks to all the speakers for their very fine contributions. I've got a question for Nick Dearden. This is something I've wondered about. How is it that the Gates Foundation got into the